comments or opinions of the speaker and are not meant to be necessarily construed as truth. Please keep your comments and language civil and respectful, or you will forfeit the remainder of your time. In the spirit of respect, please silence your cell phones. And first up to speak, Mr. Dan Lyon.
Thank you, Judge Becerra and Commissioners. This is very difficult for me, but I'm going to try to get through it. I come to you this morning, I come before you as all San Marcans with a broken heart. 3 of the finest men who San Marcos has ever been privileged to know were gunned down in a cowardly ambush while they were performing their duty as San Marcos police officers. We in San Marcos and Hays County pray for the family of Officer Justin Putnam, as well as Officers Franco Stewart and Justin Mueller and their families. We need not pray for Officer Putnam because he is in the arms of his Savior and Creator. In a land where there are no longer any cares or sorrows. One could be tempted to ask, where was the Creator on that Saturday evening? Do not ask. He was on his throne as always, where he never slumbers nor sleeps. Scriptures tell us that not even a single sparrow falls to the ground without his knowledge. His statutes and judgments are perfect. Why would the Creator take such a fine person in the prime of his life? Perhaps because he had learned more lessons in his 31 years than I have mastered in over twice that many. In short, he was not taken because he did anything wrong. He was taken because he did so many things right. Scriptures say that the Creator knows how to preserve his children from the evil to come. I did not personally know Officer Putnam, but from everything I have heard, I find myself looking up to a man who was half my age. His passing has united San Marcos in a way that nothing else could have done. Scriptures say that greater love has no man than one who would lay down his life for his friends. I would say that it takes a lot of love to lay down your life for a stranger. Officer Putnam will be missed by all San Marcans and by all Hays Countyans. Thank you very much.
Thank you, Mr. Dan Lyon, for that heartfelt message. Next up, we have Mr. Rodrigo Amaya.
Thank you, Judge, Court. I too would like to wish and the family of the deceased Officer Putnam, may he rest in peace, and to the Stewart and Mueller families, they'll be in our prayers. I would also like to thank the pastor that has been showing up often. I know for years y'all had a trouble finding individuals to come up here and say the prayer. So I want to thank him, for Reverend Maldonado, for showing up and bringing some stability, especially right now during these trying times. Couple of things about the courtroom, the quorum sheet y'all have over there that hadn't been touched since 1998. It's a one-pager. I used to be a marshal for the city of Lockhart, and there's courtroom decorum. Some of the things that were prohibited were like drinks and stuff. It's very disruptive. There's certain individuals who come up here with their coffee cups and stuff, and that's disruptive. It really, to me, I think it's inappropriate. Just something to possibly think about getting rid of. Commissioners, thank y'all. Y'all been doing an awesome job with the crisis. I want to thank y'all. I've seen a lot of y'all doing y'all's part, in whatever part of the county y'all are from. But I also wanted to share with y'all, the LA Times on 3/31/20 at 2:05 PM posted a article that the LA supervisors removed the sheriff Villanueva from being the head of the emergency operations. They had concerns about his ability to lead that community. And, some of the things that I've been noticing from the folks in charge of that, I might want to start thinking about possibly pushing in that direction, because I have some problems with the leadership, the way things are happening around our county. Lots of phone calls about all the inconsistencies in the information. And that's a concern, especially during these trying times. Corridor put out that issue about transparency and certain things that are being done behind our backs, about the purchases of items and stuff like that, violations, transparency issues, conflicts of interest. So, without all that, if you look at, they call that the totality of the circumstances. You put it all together, it justifies removal and taking action against individuals that are participating in that kind of questionable conduct. Again, just want to thank all the commissioners for their part. I am very, very happy that y'all are doing a lot of the things that y'all have done. The other thing I wanted to finish out was April 8th, Facebook post. There was a post about a JP's office opening up to taking calls, collecting money and all that stuff. There's some issues with that. There's some issues with that because there's a due process and defendants have to be notified. Thank you.
And will you please open agenda item number 1?
Number 1, update from the county judge and staff regarding the local disaster declaration and COVID-19. Possible discussion and action may follow.
Since you're up, Ms. Crumley, would you mind taking the podium and giving us your part of this COVID-19 update that we give every week to the court and the community?
Morning, Court. We have continued to work on gathering information from the medical community. I emailed out last night. Actually, it was stuck in my outbox. I apologize for what time it went out. The health department sent out a questionnaire on what testing the medical community was seeing coming in through their practices and the numbers, et cetera, that they were seeing, how many patients they were turning away, who they were referring to, if they were testing in their offices, and a spreadsheet was created with that information. Based on that, we gathered that there were several places that were open to the public, and then some that were requiring citizens to become patients of those practices. So there are several locations that, in addition to the ones, Judge, that you went out Friday and were able to advertise that were open, testing citizens. The items that we have this morning on the agenda are asking the court to approve 2 locations for us to continue testing. One is the Premier ER, and the other is Live Oak, to open up another facility on our Broadway location next to the health department for testing. Eric emailed the numbers this morning. I haven't had a chance to open them up. So that's what we've been working on. Do you have any questions on that? Eric's here, I believe.
I'll give Eric a chance to come up after you. Commissioner Inglesby, we can go one by one for any questions for Ms. Crumley on what you've described.
It would be really helpful, with that spreadsheet. It was kind of difficult to read just because it had different sheets on it. Maybe you can compile it for us so that we can, more easily read that. And then I guess I heard you say that we are going to start providing the testing?
That's up to the court. I have an item on for discussion
Okay.
on whether or not that's what the
Okay, so
court
we'll
wants
discuss
to
that,
do.
whether or not to provide the testing there at the Live Oak or
Yes.
their health clinic.
And that's related to the funds that were available through the grant that that you guys approved last week.
Okay.
How many tests do we have a day now available?
We have 100 available to us. To date, we have provided 137 tests to that group of individuals that we've identified.
Thank you.
Commissioner Shell?
I just want to thank them for this. I've had some conversations with Ms. Crumley over the last week or so on some strategies and trying to get some information from providers and see what is happening and what they feel where there might be some gaps. It did seem that PPE is still an issue for some, especially related to being able to provide testing. So that's not a surprise. I know we've been working on that. Some questions around testing strategies and knowing that we will talk about that later on those items. What type of ideas are that to open that up? I know we've discussed who is primarily tested now through our agreement with, what's the name of it?
Premier ER.
Premier ER. And if we were to expand that, how would we expand it and who would we expand it to? In other words, would there be, following some national news, there's been some recommendations that testing healthcare workers and first responders is ideal because they are more than likely to be the ones that have come into the most contact with infected individuals. So one question would be how to ramp that up. The second would be where you take it from there to what portions of the public and how that's decided, symptoms, if it's symptoms only, if it's used for contact tracing. And so I'd like to hear some ideas about how we can expand the testing in Hays County and take on some of those other areas.
That would be on a case-by-case basis. Eric would, and during his interview process with the individual who's being tested, who they've been exposed to, and then go down the chain of how many people they've been in contact with, if it's say a nurse, how many patients she's visited, if it was in a home who had other residents, visit with that nurse about her contact, and then if it was an EMS employee, the same thing, how many patients that they come in contact with, their fellow coworkers, just kind of go through that process. So each case is unique.
And what about, has there been consideration for just vulnerable populations, whether it's, those with pre-existing certain conditions, whether it's age, whether it's, our indigent population? Has there been some look into how we could deliver testing to those populations?
I've identified if there's, on the proposed contract with Live Oak, it's our indigent population that's not, we've identified as not covered. Medicaid and Medicare cover testing as well as insurance companies. So identifying that our indigent population is not being provided testing is who we need to look at to cover them for testing. Live Oak would be able to do that for us through the health department. They would go through, a process of, reaching out to the health department to be evaluated the same as anyone else.
That's beautiful, and thank you, Commissioner Shaw, for those questions. And what I tried to display through my touring of the county, showing, and every chance I had, I said, this is not an exhaustive list. This is not all-inclusive. Please call ahead. Here's their phone number. I still get people asking me questions. Can I just walk in?
And it changes every day.
And it changes every day. And so I know that these are difficult times for everyone, and I know that people don't handle stress the same. And some responses are out of fear. I mean, there's no better way to describe it. And it's very refreshing for me to go all the way to Dripping Springs. It's the farthest city from here where we're sitting today, and start my way back and just hitting some highlights to show people, guys, there's testing facilities there's bricks and mortar, there are medical professionals waiting for you to come. And so that was my attempt, and I've got a lot of great response from it, and thank you for bringing that up. And I think the next piece will be to articulate how some of these people that are basically unemployed, uninsured, don't have a doctor, can get tested. Because there's just one click up above that, which is the other front line, which are the people that are working at Popeye's Chicken and, you know, all the other places that are open and feeding our slowly moving economy. There are a lot of people that are low wage, uninsured, single parents, and that you described is very wonderful, because as soon as you articulate that piece, I'm going to broadcast it, and I know that Laureen does a wonderful job of communicating as well, because 9 times out of 10, people aren't going to need something, but if they know it's there, it's going to help them feel peaceful. And as I said very early on, one more thing. As I said very early on in this pandemic, 50 to 70% of our population will become COVID positive if tested. We don't have to get nervous about a positive number necessarily. It's 20% within that population that is a vulnerable type, that does run the risk, that could utilize a hospital bed, or what we have now heard through so many governors' conversations, ventilators and other things. And so when testing continues to open up, because make no mistake about it, I am not stopping. I will continue to try to bring more and more supplies. Testing is one of them to our county. As these things continue to open up, our numbers are going to climb. And I just want to remind people to know that the job they are all doing is magnificent, it is painful, but it is very useful. And as these numbers keep clicking up, just know that we are here for you, and we have facilities continuously opening up to care for them more. You were going to say something, and then I'm going to go to Commissioner Smith.
Given our limited, right now, number of tests through our grant, I mean, we have to still set some parameters on those who get tested. Just open it up, and those are things that our medical authority was going to be here, but he's experienced a medical emergency of his own, so he's not able to be here. But we still need to triage them, and those who, you know, fit in the criteria need to be tested. Just open it up to, you know, say myself, I showed up today, I'm not exhibiting, I'm asymptomatic. Assuming I would be negative, I would need another test, you know, if I, next week, started showing symptoms. I've now used 2 tests, one that could have been used for someone who needed it. So we've got to look at, you know, those situations.
And just know that we are working diligently with the state. We have been and will continue to bring a state-run testing facility to cater more to the general population as an additional avenue for folks. Commissioner Smith.
No, I was just going to say thank you again for pulling all the data together. And then to your other point, my concern is that I don't want a perception out there that if we are able to secure, you know, hundreds or thousands of tests, that they would immediately be available for the general public. Because at the end of the day, the CDC has really done a very, very astute and direct job of outlining who should be tested. And the CDC is very adamant on the parameters for testing and those kind of things. And while some of those are dictated by the number of tests available, it's really dictated by the need more than the availability. And at the end of the day, there might be additional opportunities, but my biggest concern is ensuring that while we have those additional tests that aren't being used today because we don't have the population who are impacted by those symptoms, what we've seen or what in the research I've done, what we've been able to see in some of these states that have been much harder hit, and even the countries that are now trying to pull themselves out of the economic turmoil they're in, This isn't, we as policymakers and as health professionals, y'all have really like to talk about flattening the curve, but what we see isn't really a curve. It's a curve on the front end, but it's a wave. And at the end of the day, we're gonna have reinfections in the fall. We're gonna have reinfections additional where we're gonna have peaks and valleys in our population. And if we don't have those supplies prepared and ready for whenever those peaks reappear, and have those tests stockpiled that we aren't using now, then we could be in trouble. And so I appreciate that the research you've done, and I would just continue to say thank you to our epidemiologist, Eric, who's sitting in the back as well, for his work, and just ask that we continue to follow those CDC guidelines.
Absolutely. I mean, we have to if we're not going to have enough. But I feel like that those who want to get tested and those who need to get tested have that opportunity. And be mindful of, that limited number of tests. But again, I feel like we're not seeing a surge of people who are just going out to get tested for the sake of getting tested.
Tammy, that was my question. I was wondering, are we turning anybody away that want to be tested because they feel that they have the symptoms? And I think I just heard you say no.
And I haven't seen that, and that wasn't the response from the questionnaires that we sent out. The doctors that are sending people elsewhere that, can get tested, but they aren't the only reason they're turning patients away is because they're not providing the testing, but they're able to send them elsewhere.
So just to be clear, it's hard just to articulate further Tammy's great point. We don't know what private practices are or are not doing. We don't have, because I get asked continuously, how many tests do we have in Hays County right now? Well, I can't go into a doctor's office and rummage through their shelves and get a number. We have a limited reach and understanding as to what private practices are doing. And the lion's share of this is run by private practices. But they're doing a wonderful job of compiling and gathering and making information available, and that's the front I'm on as well, is sharing what is available, because as Tammy's pointed out, it's not necessarily a constant theme of being turned away, but those that do, we got to make sure we understand why, and that we can shed the hyper-rationing mentality when it needs to be. But we have a couple more people that are still going to speak if you want more on that as well.
I mean, I was just I know you said that there is an agenda item to consider the health department as a testing location. And I was just wondering if we approve that, that would give us another area where I think a lot of the vulnerable population may feel more comfortable calling in and asking these tests.
Right, that's the hope. Tammy, if you have nothing else, my hope is to next bring up our epidemiologist to explain further. Did you have anything else for Tammy?
Yeah, well, I was just going to make mention, you mentioned about driving to different testing facilities and seeing them. I've visited a couple as well, and I found it interesting that the facilities that are there, one of the concerns that I have, and this might sound like an odd concern, but I have this concern relative to our emergency rooms, our hospital space, and our testing facilities, is the fact that right now, people aren't going to, and not that I'm advocating this, but people aren't going to the hospital if they get a cut on their foot. If they sprain their wrist, they're not going to the hospital for an emergency room visit as they had in the past. And so one of the concerns that I'm hearing, especially from health professionals at this point, is that they are actually going to they're going to make some hard financial decisions over the next probably 2 to 6 weeks relative to whether or not they are going to continue to maintain all of the personnel that they have. They're going to have to look at, are we going to have, are we going to cut our nurses back 30%? Are we going to cut our lab techs back, 20% because they don't have the business, just the general everyday work of the hospital or the patient care system that they have, that they would in a general sense. And I think that, Judge, to the point I'm getting to is whenever you did your tour around to all the testing facilities, I think it was probably pretty obvious that there wasn't anybody at a lot of those. And those citizens aren't showing up. Unless they have the symptoms or they're concerned, then they're not going to get tested. They're not, because they don't want to put themselves in any type of jeopardy either, which makes sense. But as we look at what we're going to do relative to not just testing, but how we're going to interact with these practices and these medical professionals in the near future, we need to be very cognizant that if things don't change from where they're at today, we may have less of, we were very proactive, and I say we, the state of Texas was very proactive in securing additional bed space. For example, some of the hospitals here have set aside whole floors of hospital space to address this crisis. When you set aside 100 beds in a hospital, that's 100 beds where nurses aren't working and doctors aren't working until that crisis hits. And so we just have to make sure that whenever it does hit, if that rolling wave does continue to hit us, that we've got medical professionals that can staff those things. And that should be a concern that we have when we look at testing, when we look at addressing this need in the future. So that data that you provide is very helpful.
Thank you, Ms. Crumley. Next, I'd like to call to the podium Mr. Eric Schneider, our epidemiologist. If you could state your name for the record, what you do, and if you don't mind giving us a brief overview of what's going on.
No problem. Good morning, Commissioners. Good morning, Judge. Eric Schneider, epidemiologist, Hays County Health Department. I'll quickly go through, as of 8:30 this morning, been here for a little while, but I'm sure I have a few more. But at this moment, we have 137 lab-confirmed cases in Hays County. Negative lab reports that have come across my desk, we've had 749 negative lab reports. To my knowledge at the moment, we have about 27 to 30 pending tests. We have cleared 58 people. These are people who tested positive, have gone through the disease, let it work its process, and they've been cleared by the health department. So active cases right now, we have 78 active cases in Hays County. We have had one fatality due to COVID-19 complications. Total hospitalizations, there's 14, and current hospitalized, there's only 4 people that are currently hospitalized in Hays County that are Hays County residents. There are other that are hospitalized, but they're not Hays County residents, so they're not counted in that number there.
And Eric, if there's somebody that's hospitalized, for, say in San Antonio, but is a Hays County resident, that person would be counted as hospitalized?
Correct, yes ma'am, I know about those. I don't know how much farther you want me to break it down, but we can go back.
I think that's a good start. First, we could start there. Does anyone have any questions? We could start from left to right.
Actually, I do. I know that I have heard that we are starting tracing, or that we're doing some type of tracing. I know that in speaking to some folks from the state and looking at some of the national numbers, in the next legislative package that Congress is considering, they're looking at investing heavily to identify and hire tracing experts throughout the country. What have we done on that front, or are we doing on that front?
We have done contact tracing from patient 1, all the way from anybody that tests positive gets a phone call from me. I talk to them about their job, their household contacts, any contacts that they had 14 days prior to that. If there is somebody who is most likely going to be susceptible because they did spend a lot of time with them in a close proximity, I reach out to that person as well to notify them. So we have been doing contact tracing since patient number 1.
So I guess my question is, we're kind of, and that was my assumption, and the reason I asked that question is because it appears to me with the, at this point, lower number of tests, or no, lower number of positive cases that we have here, the contact tracing, what y'all are doing with that initial interview process that you outlined for us a couple of weeks ago, you're really getting that information on the front end rather than the back end.
Correct.
And where you're really seeing problems, or what it appears we're really seeing problems on the East Coast and West Coast, is they're contacting people a month after they've tested positive, or they're contacting them 3 weeks, and at that point, what you find is the data isn't as good because somebody can't remember where they were a month and a half ago. I commend you for the 37 phone calls I know you've made, at least on these, to do that contract, or that contact tracing, because having that information on the front end really does get in front of the infection rate on the back end. So thank you. That's all.
Michelle?
I want to thank Eric. I know he's worked extremely hard throughout this and appreciate everything that he's done and that staff has done there. I know that it's been challenging. Just the only question I have kind of goes back to testing and the testing. Now that you have received the information from all of those providers and we have those agreements that we'll discuss later, is your belief in how that would be implemented? Do you believe that will take care of the need that you have for what you're trying to do during this?
I think it will. It'll make it a lot easier. I mean, we do have the testing facility that we're already currently doing with Premier ER that tests healthcare workers and first responders. And there hasn't been a single first responder or healthcare worker that's been turned away. There was one instance where somebody got some bad information and drove down to San Antonio to go get tested when we could have done them here in San Marcos. But that's the only one that I'm aware of where somebody actually had bad information. Opening up a clinic, especially at our health department location at Live Oak Community Clinic, would address the vulnerable population, the uninsured, underinsured, indigent population. At the moment, we have, if you have insurance, you have Medicare, Medicaid, you can go see a physician and get tested. It's the people who are falling through the cracks that are uninsured and underinsured, that those are the ones that we need to be able to address. And I think the Live Oak Clinic would be able to help out tremendously, or even just expanding the Premier ER, either one would help.
Thank you.
I just want to thank Eric and his staff. Y'all doing a great job. The updates y'all are putting out every day, I appreciate it.
Yeah, I thank you also, Eric, and everybody that's here and those back at the office. I appreciate what y'all are doing. Also, is there anything that you need from us? Is there anything that we can be doing or providing to you all that would help in this situation?
At the moment, we're good. We've got a couple interns, more staff that are, everybody's pitching in. It is a team effort. I know y'all see me and I'm the one that's up here talking all the time, but it's definitely a team effort by the health department. So at the moment, we are covering everything good, but items addressed later on in the agenda would be the only things that we're looking for, and that's just more testing so that way we can open it up.
Thank you, Eric. Thank you for closing with that idea. Next up, we'll have Alex Villalobos, our Emergency Management Coordinator. State your name for the record.
Alex Villalobos, Emergency Management Coordinator, Chief of Staff for Hays County. And I just wanted to go over real quick with regards, I know I've probably about a week out given you guys a very high-level plan. And I think that with regards to the information that we're discussing today, it looks into that data gathering point and timeline that we need to be in. The sooner that we get and compile information, and as best as we can through our current resources, I think that's when we get closer to really having a good idea and direction for the rest of the plan. Testing, whether it's positive or negative, and then start looking at the population on where they've been tested, specifically some of the areas that are really at high risk in regards to their comorbidities, is really going to give us a good idea on to make policy decisions. Currently, we don't have data to make policy decisions. We don't have enough, and we need to get to that point. We're doing it as best as we can with the resources that we have. Obviously, we had some discussions on our capacity to test. We're not full board testing at this point. I understand there's been some discussions with regards to the need for that based on symptoms. But I think that towards the end there, we're looking at different ways to open up different testing sites in in the best way that we can on behalf of the county. So we can start getting more data to make more policy decisions. And those policy decisions are different than medical provider decisions. I think it's really going to weigh hard for us to open up the economy. And I know I haven't had any feedback from any of the commissioners. I know you've all been busy. I just want to know that, that plan is something that I'll work with the rest of the staff with and continue to work with Rachel. And I know this will be something that'll be customized into something different when we get to the point where we're actually employing some of the other areas of a plan to start coming back to some semblance of normalcy. And that's not going to be anytime in the immediate future, but I think it would be remiss that if we make any decisions to start opening up areas without a whole lot of data and understanding what our population is going through, then I think we're guessing as best as we can and not really using the data that we can get, really, so. That's all I have with regards to the plan. I know I've provided it to you and some other staff members, and I just want to make sure that if you guys had any questions about that plan, I'm here at any point to answer.
Commissioner Inglesby, you have any questions for Mr. Villalobos?
I guess if I understood you correctly, you're saying that we don't have enough data because we're not testing enough? Is that what you're saying?
Well, absolutely. And I think it has to be scaled in. There's reasons why we're scaling them in at the rate that we're testing. And those are all, they're all multiple reasons why. And what makes sense for the current operational plan for us to do that makes sense now. I think at some point, that plan within a plan, really to create more opportunities for testing and open it wide open for the opportunity for them. But I think a lot of times, people still don't understand where they can and can't go. I know that maybe some of the people that they're talking to with their, through the epidemiologist and through some of our other opportunities for testing, Premier ER, but I have spoken to citizens that have been turned away. But those are different testing opportunities and points too. We do have some populations that felt as though they met some of the criteria, but were turned away based on questions. And I think the screening process is there for a reason. And it's number one, it doesn't stress the system, it doesn't stress our resources. So I think we have to do that now. But I think we're looking at and discussing and collaborating within ourselves as an organization and also with others to understand how we can open up that without stressing the entire system. So if you have testing, then there's PPE. Obviously, there are doctors and facilities that are concerned that they don't have enough of that to conduct the tests wide open. So, I mean, we have to balance everything, and there's a reason why there's a screening process in place. But to have officially less than 1% of the population tested, or less than, I would say better is that less than 1% of the population with data that we can make a good decision on, then I think we need to figure out a way to get more data. I mean, whether you want to look at it testing or other kind of information for us.
What other kind of information?
Whether they sought any kind of medical assistance for any other kind of, I mean, we need to hit that. I think in laying out the plan initially, I think in my immediate presentations we're looking at East Coast, West Coast. We're looking at the fact patterns of response, and what I've done is we have stayed ahead of those responses. So what does that look like for us? If we've stayed ahead of the responses of those other jurisdictions, we've done a good job. Do we know that we've done a good job? I know that we've had some municipalities within the county that have taken some immediate action and shut down their towns because of those critical elements of their population, right? So whenever we have the more testing, when it looks like we get into testing that really looks at our symptoms and then testing that really understands the population and how they've been affected by it, regardless of the test that you're talking about, and later on that comes into play, we have to understand how those populations have been affected, whether it's an antibody test, whether it's a molecular test. We have to understand how that plays into our overall policymaking. And there has been tons of discussions with all the top brass in our medical field that say the same thing. We just have to figure out how we do it for Hays County. I think that's some guidance from all of you based on the research. I'll continue to refine the plan that I provided with some more research, but I know on the back end of that plan, if I've cited all my work and where I'm pulling a lot of this data, and a lot of these doctors and these scientists are on the top of their field in creating these plans. And most of them are talking about how do we get out of where we're at and build confidence with our community. Most of them are talking about an increased number of testing, whether it's testing because of our symptoms, or is it testing because we just want to test to understand who's been affected by this so that we can start getting back into it. And then there's also a plan on scaling in businesses that do open up. And then, in my discussion so far, just to kind of give something to think about when we're changing policies, is that in the business world, how can we put together a plan that we can say these businesses will abide by, and what are some of the legal implications that we would get into by recommending a plan that says, for instance, hey, you can open up, but we're gonna request that you guys take temperatures twice a day and report those things if you have any identified people coming in that have symptoms of COVID. I mean, those are all different things. There's HIPAA things, there's the legality of forcing or asking or directing these businesses to do that. So those are all things we're gonna have to look at in the future when we put this plan together and we're working together with our community, is that how do we do that? And how do we do it with good support?
Are you reaching out to the medical professionals here in Hays County and getting with them and talking?
Well, we're doing quite a bit, and I get on the conference calls throughout the weekends continuing, and I ask the medical professionals that have been on those calls just specific questions on get their ideas, because they're doing work here in Hays County. I know that some of the single practitioners are hurting just as far as the businesses are concerned. They're hurting too. And they're willing to have a sliding scale on testing people that don't have insurance. But we need to put together a plan for them. I think they all want some direction from us on how we can help facilitate that, how we can help them. Or if it's not helping them individually, then maybe it's more helping them with marketing a plan on things that we can do. This is what we need to do next. If you guys can help us with this. And we understand that you have to conduct your business within your own organization. But are you available for people to come in for testing? And then you have individual practices that are, well, those doctors are afraid that they would get infected. So how do they manage that? And does that practice have enough PPE to do wholesale testing? That's also a concern. So those are the things I'm hearing and talking to some of the medical practitioners that are on the front lines doing this. So I appreciate your time, Court.
Wait, not yet. I'm going to go one by one. We're going to keep order in this thing in a really tidy manner. Commissioner Jones.
I asked a couple of questions. First, I don't know if it was yesterday or Sunday, the White House's press conference, Vice President Pence said that each state was going to get enough tests to open up phase one. Have you heard anything about that, or how we
Well,
receive those tests?
we've heard some information about that. I just haven't heard any detail about when that's going to happen, how it's going to happen. And I know that the Department of Health has really reached out for the rural areas to start increasing testing sites. And we've been talking with them. I know that even though Hays County is considered a rural county, we're probably lower on the need because there are counties that don't have any. So they're opening up county testing that's supported by the Department of State Health Services, fully deployed with their own staff, equipment, and that kind of stuff. So I know that there's an approach to increasing testing. I don't know how that trickles down to us at this point, but I know that when it does, then we're going to have the governor. The governor, I would assume, have a plan too that makes sense for Texas on how we would facilitate those tests. And I think that this plan, and stated when I provided it out, is that stages 3, 4, and 5 would definitely have to be in line with what the nation and the state, and then customize it to what makes sense to Hays County. How we employ the testing that's supposed to be coming, yeah.
And the other question, this may be for you too, Judge, but I'm still getting calls from retailers asking us if we're going to mandate that they, in Hays County, you have to wear a mask to go in the stores or not. Have we looked at that, or?
I think that's definitely a conversation that the policymakers need to have. I know that I think we have to respond with an abundance amount of caution in mitigating the spread. And I think we have to offer that opportunity to our population. I don't think that we can take that away. I think it's a balance, and it's more of a political decision to make, and many times, on whether we're going to require it as an order to do it. Now, other counties have, and aggressively citing their citizens for not utilizing that best practice. We have to you have to make a decision on whether that's going to be appropriate for Hays County.
Commissioner Shell?
Thank you, Judge. Just a couple of questions, and one, I think you just hit on it when you mentioned, in coordination with the state policies and even federal, you know, and you mentioned policy decisions, and kind of have some questions on what type of policy decisions do you foresee? You know, I'm under the impression that for the most part, we're going to be following our governor for the near term on when to open and how to open. That's not to mean that there won't be certain aspects of that can be tailored for us in our specific situation, but for the most part, it at least needs to be a regional decision because we are so closely related to two metropolitan areas. And so some of my questions are, how do we plan on coordinating that with our neighbors, make sure that we follow along with the state guidelines, and understanding that this testing is going to be extremely important to that. As we open, I think testing will become important to be able for us to amend some of those policies, or at least to provide information so that our state or regional leaders can amend those policies and be able to react quickly, because we don't want to get in a situation where something turns in the opposite direction. So some of my questions are, how do we plan on coordinating that regionally? And then, and also, I know all of us are concerned about getting our businesses open as fast as possible and making sure that they're able to do it safely for themselves, their employees, and the public in general. And if there has been any discussions regionally or with the state on that, I know the governor had his press conference on Friday that spelled out some of his plans. Just wanted to know if there was anything that we could share with the public in regards to what we expect to hear from the state on allowing our businesses to open.
Well, I know that we've been meeting as emergency management coordinators on a regular, as the region, as a COG, and discussing back and forth.
I'm sorry, Alex, but just for the
Council of
audience.
Governments,
Thank you.
with regards to emergency management. And I know that those policy decisions that they have in our metro areas, they're sharing them with us. You're looking at a metro area that within our Council of Governments that has a whole lot more resources to deploy, and they're testing it considerably about more. I know they're looking at other ways to saturate their communities with testing before they start really looking at it. And I think the discussions and some of the information I'm getting from here is that I'm leaning on them for some good data too, on what I mean by policies and what we see coming forward. But they're looking at the idea of testing as well. And how does that, how are they using that data to make decisions that best fit Travis County, so to speak, or Austin? That's a tremendous piece of our collaboration, and me driving down and at least offering information for us to make decisions on a regular basis. So then when we look at the state, and the state provides some of the guidance coming down on opening up businesses, I think the governor has been clear in that, yes, there's a plan, but we have to drive a large part of that plan from local government, because all of us don't fit in the same shape and size, right? And we have issues that'll be significantly different for us than it would be in Austin. I think the mainstay would be the small offices, is what I've heard, industrial and manufacturing. But still, those are very loose, and I think they're still trying to refine those positionings on opening up businesses.
Thank you.
And in addition, I'll add a bit more. On my regularly hosted meetings, Mondays, Wednesdays, and Fridays, I'm looping in all the mayors, mayor pro tems very often, and city managers, so that they can weigh in on what they feel is most useful from my office to support their efforts. For example, I want to applaud Mayor Gloria Whitehead. She was the first one that dove out there and said, I'm shutting my city down. And she was ahead of us as a body of elected officials. And I think it was very fitting. I think it was very right, and it was a very good call, because if you look at the demographics of her population, she did exactly right. And as I've seen, of course, there are political hiccups, but as I've seen, I have a deeper appreciation for our government as a whole, because the federal government is breaking off direction for the states for finer granulation of what they see and need. And I've seen our governor break off articulations that are, I believe, intended to be a baseline threshold so that we could, as individual counties, articulate our specific need. And so I've followed that roadmap to the best of my ability by looping in the municipalities in our county to make sure they have an opportunity to have the flexibility to weigh in for the maximum utility and the maximum efficiency of an order. Because as the governor has pointed out, there are entire counties that have more cows than people. And so some of these blanket orders statewide may not always make sense to a specific county. Nevertheless, we as local governments are charged with articulating something that is most useful for us, and balancing, of course, that ever delicate line of COVID management and local economy. So it is a very, very relevant and common theme that we're always talking about, Commissioner Cheryl. Thanks for the question. And I could say, have been personally very deliberate with my message, which has been to bring resources to the front line so that the professionals can get what they need. And very early on in March, I heard that testing was going to be a part of it. And I know that as this unfolds further, as people become more aware and more comfortable and the evolution of thought takes place, that's part of the roadmap to getting us back to work so we can understand who, what, where, when, and why. And so it's all part of no one's been here before, so it's part of a complex medley of factors to weigh in. And I've deliberately, with the counsel of our general counsel, Mr. Kennedy, I'll say it again, he has been doing a phenomenal job, has been very accessible and very productive with me, with our moments on the phone. And he helped me to interpret at a high level the governor's order, because I don't want to create confusion. And that's why we do what we do, and that's why we have every Monday, Wednesday, Friday call, with few exceptions. All the local elected officials as well at the municipal level, so that we could have synchronicity to the best of our ability. And I've also asked them to be patient with me, because I do have certain mayors asking me to put that mask order in place that you've asked about, Commissioner Jones. And so the idea is, it's about a flow of information that is not knee-jerk, that is a walk with caution, and very often it's not going to be most popular, but it needs to be most useful, in my opinion. And so that's why, with the help of our general counsel, I have deliberately delayed any further local action, trying to ferret out the maximum benefit of the governor's order first.
Commissioner Shell, just to kind of touch on that last question again, just, I guess, an example for me and how I could probably best address it right now is that the testing and then also the contact tracing that they're doing in Travis County have allowed them to kind of identify their clusters. And when they have that ability and they have the data that they're getting in, they're able to respond to those clusters and create mitigation plans to kind of slow that coming out of those clusters. So I think you talk about how we utilize data in comparison to what's coming down from the feds into the state and then what it looks like for us. I think that's probably an opportunity for us to get, we're not getting that type of data as of yet. We're doing a great job, but if we do, then it's going to require a plan, and then how do we do that plan with very little testing? And I think that's really an idea. I just wanted to touch on that one piece.
And I guess that's understanding that what is it they're doing? And I guess that's kind of the question is, what would we do if we found that there was an area in the county? Now, Kyle seems to be the highest number of positive cases, for instance. So maybe a good question would be why? Why is it there? Is it population density? Is it certain areas of the city where they happened.
And I think that's probably a good question on how we balance all the testing sites throughout the county. If you look at the testing sites available throughout the county, Kyle has the most testing sites, so they're getting a lot more data, which is, and therefore, you're probably going to have a lot more rate of infection, right? You have broad population, more testing ability, and I think, well, there's some other issues as well that come in with that, but I think when we're deploying the plan, for looking at, okay, what's really happening across the county, then I think it's maybe in the future, we'd start looking at, well, how do we balance these testing sites? How do we put them in so we're hitting the same numbers? And I don't know that we can, but that's one thing. And we've had discussions about that. I know I've had discussions with Eric about that, and people have asked him some direct questions. I've learned pretty quick on his responses is like, well, the city of Kyle does have more opportunity for testing. They have a large population too. They have multiple sites in comparison to other municipalities.
But what is the change in response because of that? I guess that's what I'm looking at. If we have identified whether it's because the individuals in the city of Kyle have had more contact and spread it more, if it's because there's more testing, which we all realize would probably result in increased positive tests. What's the difference? What do the local governments do?
I think he was, the city of Kyle, the mayor took a position of, a little bit more aggressive position earlier in the pandemic response. And I think they're still waiting for how that's going to affect them. We pretty much shut everything down. Wrapped up things, the contact points, a campaign for hand sanitization, masks. I mean, it goes on and on and on from there. And then we start backing off from that point once we start flattening out, right? And now they're in the balance of, okay, how do we balance overall response and a restrictive and a directive response with the mental health of people and giving them the opportunity to at least walk outside? And I think they're taking some heat with that right now because of what you're pointing out. But I think they've probably been one of the most aggressive in the county. If you look at it from that standpoint, and then pretty much everybody follows the same, well, the only thing that's changed, the only variable that's changed throughout the county is more opportunity for testing. So, on the converse side of what you're pointing out, if we had more opportunities here in the same way that Kyle did, our numbers would probably increase. And then we would really understand, okay, what we're doing is not effective. Do we have to change what we're doing? And I think that's a conversation for our health department and our health authorities and officials to say, hey, where do you think we're lacking? Where do you think could change this behavior or this infection rate?
And I guess that leads us to the question of let's assume the city of San Marcos or this area around the city of San Marcos has a percentage of positive tests similar to Kyle. Let's say it's because there's not enough testing locations. What should we do? Why wouldn't we do it anyway? In other words, if there are measures that could be taken that would protect the public or reduce the potential spread, what would those measures be, and why wouldn't we consider those
You're
right
exactly
now?
right. Yeah, I would. I mean, I understand what you're getting at, and I think we should consider anything and all of it as much as we can until we see those numbers start to flatten or they start going in downward turn. And I think that's the scary part, right? Is that how long does that last? You guys are talking about businesses and commerce. How long can we hold off? And I don't have the answer to that.
I don't think much longer.
You're right.
I don't
You're
have the
right.
answers to that. So it's going to be interesting. And I think Commissioner Smith came up with some really good points in when he was asking questions up here. When do we get to that? I don't know. It's going to be waves. Our curves they look different, and everybody calls them waves. Yeah, we're waves in comparison to some of the other metro areas.
I know, we're pond ripples compared to the
But
others.
for Hays County, those are curves for Hays County.
Commissioner Smith?
Yeah, I just had a couple of questions. The plan that you sent out on Monday night late, I know it was dated the 14th, but we got it Monday, so I haven't had as much time to go through it. So I've just been going individually and looking at what the governor's announcement looked like on Friday. And one of the things that I think there is a general assumption and looking at the data that he put out, and the folks who are on that task force, in general, looking at it, they're looking at least a 2-week drop in infections before they look at anything in a given area. And so when we're talking about individual, one of the concerns that I have is that over time, as we begin to look at this, we have, as you expand your additional testing to those non-target populations, one thing that you'll have is that you're going to have, just as our numbers look like now, you're going to have a whole lot more negatives than positives, which is a good thing. But the other question that I have is, what impact does that have whenever they're looking at their overall numbers of percentage of growth? They haven't been really clear on when they say, well, you have to have less infections in the next 2 weeks. So the question is that as a percentage? Is that as a number of infections? Is that there's no clear direction on that.
Right.
And so if we're testing 1,000 more people a week, which is, I mean, I don't think there's any way we could do that right now, but say 1,000 more people a week, and lo and behold, as a percentage, our numbers are going down as a percentage of those that are tested, that come back positive, but our overall numbers of positive tests are actually increasing. So the state is going to have to make a determination as to, okay, well, your numbers are going up, your physical numbers. Your percentage is going down, but your physical numbers are going up. And they haven't outlined that to us yet. And so I have a concern with that. Looking at the overall plan that you sent us, I think that there are goals in there, but it's not, I would just stress as you begin to work through this, that two things. You always start off with the goal in mind, but your plan is how you get there. In the document you sent us, it's really, okay, here's what our goals are for the different phases, which have been identified by policymakers or by the state and by the federal government. Yeah. But there's no plan to get there. And the plan is the journey. I would just ask you, if as you start to look at this, if you want to get us something with more of the roadmap, less of the destination. Does that make sense?
Well, I think you pointed out, Commissioner, is that the roadmap is still
right.
very, very, very fluid, and that's even at the federal and the state level. So for me to do that roadmap outside of getting some good concrete data from those particular levels of government, I think it's probably would be remiss for me to put together a plan to say that, hey, I know better than what those people are doing, and I think we need to be cautious, and I think that's also on purpose, is to get some guidance from all of you as you guys are receiving data too, and incorporate that into the plan in and of itself based on what I'm hearing from the professionals that are on the front lines too. So that's what I'm trying to do, and plug in wherever you think, and I'm taking notes now, and I'm going to take that as direction and get more data and plug it into that particular area, and that's what I'll start doing.
And to that point, I would again, this is the situation reports that come out nightly are great, but I would again ask that you split us up into twos and sit down or at least take 15, 20 minutes to talk to the members of the court every other day or something like that, just okay. Because the situation reports are great, but I'll just use the example as the one last night had our numbers that were in the report that outlines what our total testing were, the numbers that Eric gave us today, but I know there's a whole lot more going on with that, and having that interaction would be great. So even if it's a 15-minute phone call every other day with a couple of us together to maximize your time, that would be great. And thank you.
Thank you, sir.
Thank you, Mr. Villalobos.
Thank you.
I appreciate it. And I will give a few little summaries on what I'm still doing. Of course, as you all know, and you've heard a lot of times, I will continue to work on securing supplies with our awesome procurement individual, Mike Jones. He's doing a wonderful job. He is a bona fide asset. I can't say enough good about Mike Jones. He says things like, "What do you need, Judge? Put me to work." That stuff stays with me, man. That's a great can-do attitude. So I'm continuing to just be the squirrel looking for leads. People know that I'm looking for supplies for our county, and so I'm getting contacted on every range, every way. Even if I stopped, I would probably still get leads and numbers for 6 more months. So I do what I can to validate these leads, and if they look promising, I forward them on to the front line that is charged with procurement. So I want to thank our front line on that front. I'm also looking into, I know some of these answers, but I'm doing this for the viewing audience. I'm looking into property tax relief. I have a strong belief that this is a governor's order. Nevertheless, I want the community to know that I'm looking into it. Some of the conversations that have been put forth are taking the property values of the previous year or some different variables. There is no roadmap, but I am interested in having those conversations and seeing what we can do, because I know that our snapshot of property values were created when no COVID was in sight. And so now people are charged with paying for something, and so we're just trying to balance that conversation out. 2 weeks ago, I asked our auditor's office to help me with creating projections, because as you know very well, the budget season is upon us, and I have asked them to help me shape some projections as to how this shutdown economy is going to affect us, and what I could tell for direction to department heads and all elected officials as how to work their budgets for their different offices, for their precincts, for their departments, so that we could have as close to a workable budget for me to present to the court, and not have someone, for a silly example, asking for 30 Tahoes. It's just a silly example. No one's asking for it. And I have in my mind the farthest from that. And so I'll be working with them to generate a letter to go out to everyone, so that they can at least get a tone, a tempo of what to expect on the budget's front, so that we could be more in line with the budgeting piece. I've also been working closely with our business leaders in our community, economic development, different bodies of economic development, and J.R. Gonzalez, that's Chambers and Economic Development Arms, GSMP specifically, has generated a really nice letter. A couple of weeks ago, I asked them to help me articulate some of this work, because as you all know, I don't have infinite bandwidth, and I've tapped on the business professionals, which have probably a little more time than they'd like on their hands, to help me articulate some of these studies and put them in a way that is easy to understand and useful, because my message is the same, but if I have someone else communicate it, then I may have a better chance of reaching a different audience or a greater audience. Continue to look for ways for testing. Yes, our population needs more testing, and to touch a little bit on the question of how that's going to work when we have higher numbers of COVID positives with trying to open, because I'm in the trying to open camp. If you wanted to say, are you trying to close or trying to open? I'm in the trying to open camp. I will make that very clear. But public health is the biggest priority. So I know that the way that the policy has been written at a state level right now, it has been triangulated where that will be a local decision, And my hope is to get more testing so that we could have more information, so that we could know moving forward the penetration of the COVID infection the virus in our community. So we could say, hey, a bunch of the people have already had it, we're good, and we could open this layer and the second layer and the third layer so that we could ultimately have a semblance of normalcy again. I will continue to push for FDA-supported testing that is medically guided. I've seen what other counties are doing, and I have an appointment to go see yet another county and see what they're doing, because I don't care to reinvent the wheel. I want to duplicate what other people are doing that is successful. Protecting lives while protecting livelihoods. That's the delicate balancing act that I know that we're all sitting on here. I'm working with our Congressman Doggett and Congressman Williams. They are, Congressman Williams called my office yesterday. I played a little phone tag with Congressman Doggett. I am working on expanding that free testing that I know we need, because something else that I was able to acquire so quickly was when Jason Giulietti, when I asked him to help me get some general baseline demographics of our county, he immediately spit that out effortlessly, and I thought that was beautiful, and I'm eternally grateful for all those that are helping me. And the truth is, a huge, huge percentage of our community is, especially now, unemployed, underemployed, uninsured, underinsured, and they don't have a relationship with a healthcare provider. So we got to figure out a way to capture that, and through federal support from our congressman, I think we have a good front on that. So I will forward this on.
Go ahead, I'll just add one question when you get done.
Okay, I will forward this letter on that Jason Giulietti and his team have put together, that I asked him to help me with, interpreting the many studies that are going on. And I'm not going to read the whole thing to you, although I think it's all very valuable. But some people ask me, some mayors have asked me also in our 3 times a week calls to articulate the testing differentiations. And so that was one of the pieces I asked Jason Giulietti and his team to do. And the general 2 breakouts are serology testing and molecular testing. And here's what he provided to me, and I'm going to read excerpts of it, and I will make this available to the public. Serology testing. Serology testing of the COVID-19 is seen by the medical community as a major step in surveillance and recovery efforts, since it can show how the virus impacted a community. Serologic testing is not an effective method to serve as a primary diagnostic tool for current infections. Instead, it is useful for understanding patterns of past exposure to SARS-CoV-2 and the background rate of immunity in the different populations and geographies. This data is important to inform the public health decision makers. To best apply the benefits of serological testing, it is important to fully understand what it is. It's not what it is not, and how it can best be used as a tool to help the world emerge from this crisis. That's why, if you'll remember, I've said that the tests are not silver bullets. There's no one test better than another. And I've also used, I'm happy to see it here, I've also used that tests that get added, whether they be, however they come, are to be taken as tools in a toolbox. So that was nice to see how they worded that as well. And it's best summarized, he cited the FDA on this report, which is serological tests can play a critical role in the fight against COVID-19 by helping healthcare professionals to identify individuals who have overcome an infection and in the past have developed an immune response. In the future, this may potentially be used to help determine together with other clinical data, and such individuals are no longer susceptible to infection and can return to work. In addition, these tests can result and aid in determining who may donate, boy, I can't read this morning, a part of their blood called covalent plasma, which may serve as a possible treatment for those who are seriously ill from COVID-19. In a press release from the National Institute of Health, Anthony Fauci, MD, NIAID, states, this study will give us a clear picture of the true magnitude of the COVID-19 pandemic in the United States by telling us how many people in different communities have been infected without knowing it because they had a very mild, undocumented illness or did not access testing while they were sick. This crucial data will help us measure the impact of our public health efforts and guide our COVID-19 response moving forward. You can go on about it, but it's something I'll make available to everyone. It's the effort of never, ever, ever trying to do anything but to come from a grateful place, from a place of love and not fear, to say, I am doing my best to get us what we need so that we can all be calm as we can, get back to work, get back to our lives, get back to school, and get back to all the things we're doing. And so I want to thank the Greater San Marcos Partnership, Jason Giulietti and his team for putting that together. And we will continue on these general fronts. Any last questions for me before we go on to the next agenda item?
Judge, we've got several of our chiefs and first responders, if they
Do you-
can,
Do you want me to see if any of them want to come up?
they
Do
wanna-
any, by a show of hands, do any of our first responders want to speak on this agenda item? Doesn't look like it.
I think-
You have one? Okay. Please state your name and approach the podium.
Good evening, or good afternoon, Judge. My name's Clay Huckabee. I'm the Fire Chief of Buda Fire and EMS, Hays County ESD number 2, Hays County ESD number 8. I just wanted to come in. I sent an email last week to the commissioners and the judge expressing some concerns. Last week, there was a decision to split the EOC. We had a combined EOC in Hays County between Hays County and the city of San Marcos. There was some frustration that came out of that because the chiefs in the county, the frontline first responders were not part of those discussions. So there was some frustration, and it was discussed during phone calls and whatnot. Now coming out after the fact is information that it was kind of a procedural thing for Hays County and the auditing and financial piece of it. So the first responders on the front line, we didn't really see much of a difference, if any at all. We're continuing to do what we need to do on the front lines, to provide services to the citizens, to respond to COVID-19, making sure we're doing what we're doing. So I think the frustration came not only from myself, from other chiefs, not knowing what was going on and those discussions not being had with us prior to that decision taking place. I think if those decisions or those ideas would have been brought to us on the front side, probably wouldn't have had as much heartburn. So I think that's where my frustrations came from, a lot of the fire chiefs came from. I'll rest assured to let you know that we are doing everything we can for the citizens. The fire and EMS organizations in this county are providing a great service. We're out there on the front lines every day, responding to these calls, possible COVID patients, transporting them to the hospitals, deconning our patients, or deconning our units, and putting our staff back in service to respond to the citizens. So, again, there was some frustrations that took place. Again, if some of the legwork and decisions would have been brought to our attention instead of during Commissioner's Court is when we found out last week that some of these decisions were taking place. So it was a lot of frustration throughout the county. Finding out behind the scenes, like I said, that it was for an auditing purpose and stuff like that, after the fact, I think it's not changing anything as far as the response in Hays County. But it would have been nice for us to know that ahead of time so we didn't have some of those heated conversations during the middle of phone calls. So that's about all I have.
Thank you.
Thank you.
Oh, not yet. Just got to give them a chance. Anyone have any questions for them?
Well, I was just going to ask, Judge, because now that we've heard, what the concern was, are we changing maybe some of our practices to involve some of these discussions ahead of time? And I'm
That's a
not
question
sure
for me.
who's I'm directing that to. Is it Alex or
That's
is it,
to
who
me.
is it? Oh, is it to you?
That's a direct question to me. I'll answer that question while you're still there. So, to recap, Mr. Huckabee, what you've said is, it didn't make a difference at your frontline level, you didn't see much difference. And the decision, because it was squarely mine, and I am grateful to own it, and the decision that was made was, I'll call it administrative. It was never intended, and you've just confirmed that it never affected you at the front line. It was a procurement effort of articulation that we were looking for balance and fairness, because I personally didn't feel it was fair to the city of San Marcos to be working through all the paperwork and everything else that is needed, for example, for Buda, or for Dripping Springs, or for Wimberley. And so I didn't want to put that on them when we have a very qualified, as you heard me maybe 5 minutes ago state, Mike Jones. We have a very qualified team charged with turning that on and leading that procurement piece. And I know that if I asked him to come to the podium, he would bounce up and tell you that whenever your fire department needs anything, he will be the first guy to load it into his truck and take it to you. So the paper trail is what this was really intended for, and consolidating of supplies so that we could have hands on it, so that we could have a direct delivery method and process to you. And I made that conversation piece that I was going to take that administrative direction on my Monday call with all city managers and elected officials of the different municipalities. And I told them that it was coming, but what happened was people in that call must have not understood, and that's fair. And in court, when we talked about it a little bit more, again, information sharing, because what I want to do is share as much as I can with folks. And so I think that the information you guys saw in court was a little ahead of what you saw, of course, and a letter was coming to articulate the details, and it never did, as you've already said. It never affected you. It was never going to affect you. But including you before I tell the elected officials will absolutely be the way I do it next time. If there's any changes, I will tell you guys, and most importantly, because I do this to all the people on the calls, make sure that I'm doing what is helpful to you. Make sure that you understand what I'm up to. And I've had that continuity of communication in every way possible. And although we may not agree, I always take your comments into consideration. So moving forward, we've buttoned up some of that dialogue so that, although, again, thank you for starting with, it didn't make a difference for you guys physically for your response. But again, I want you to know that I heard you loud and clear. What you do is very important to me. I've done nothing but been proud and appreciative of the front line. And if something I have done made you feel marginalized, I will absolutely own it. I will absolutely apologize for it. And I am changing my communication course where the group of elected officials will not be first next time. You will be. So I've heard you loud and clear, and I will fix it.
I appreciate that, and again, it didn't change the response on us. What we heard is there was a split of VOC. We
And that's
tried to
not
get
accurate.
clarification,
Yeah.
and we weren't given the clarification. So I understand you discussed with elected officials. The problem with that is you have 10 emergency service districts in this county that provide fire and EMS and first response service that are not on any of those phone calls. So the commissioners are not aware of what's taking place. The only cities that have fire and EMS underneath them are the city of San Marcos. So if the city of Dripping Springs or the city of Buda or the city of Kyle receives this information, and the elected officials there receive this information, it's not immediately turned around and told to the emergency service districts. That's another separate group of individuals that need to be made aware of that. And I think that's where the frustrations lied, is it was like a decision was made but wasn't told to the individuals that were daily responding Because in the past, we have responded as one whole county, whether it's been city, San Marcos, Hayes County, everybody involved, all the ESCs come together. So we didn't know what direction was going. All we heard was there was gonna be a split, there was gonna be a Hayes County, there was gonna be a city of San Marcos, and the underlying issues or the underlying result of what that response was gonna look like was not passed on to the fire and EMS agencies. So I appreciate your explaining that to us.
Yes, sir, no problem. And it was a very short loop of information from the Monday night to when you guys heard it officially. It was a very short loop. Nevertheless, I will change the sequence so that you never have to deal with that again.
Thank you.
I got a question for Chief. Like, you said it hasn't changed anything from y'all, so when y'all need something, which EOC do y'all go through?
We've continued to operate the way we have before. We directly just usually reach out to Mike Jones. We have the phone calls on Monday, Wednesday, Friday. We actually are doing a Hayes County Fire Chiefs local one on Mondays and Thursdays. We're probably going to cut that down to one day per week. But we still continue to reach out to Mike Jones directly. He's done a phenomenal job, as the judge has attested to, of making sure that we have supplies, we have face masks, we have PPE. And right now, all the first responder agencies in Hayes County, besides some disinfecting equipment that is much needed, we're doing great on supplies. And he's done a great job making sure that Hayes County has had the supplies for the first responders.
Would you mind, Colin, when you're done, Chief Huckabee, I'd like to just have Mike Jones just approach the podium so we could say thank you to him and just praise him.
And then, again, I think you said, Judge, I'm just trying to understand why we split the EOC. Is it because of the
It
auditor?
was administrative. It was purely for, it was our goal to articulate more clearly the movement of inventory. And it wasn't an EOC split. I think that's a description that might not most accurately depict what took place. Because, for example, I was on a call with our city manager from the county seat, and they're still handling our, as one easy example, our call center for the health department. So it's still as it was. What we have done is just teased out the procurement piece more deliberately, so as we move forward, we can, again, this is thinking ahead. There have been no problems, and I told everyone on our calls, we are not complaining about anything the city has done. They have been wonderful, but what we're doing is staging for future rollouts so that if Commissioner Smith, I picked Commissioner Smith because you're the northwest corner, so if Commissioner Smith is asking for something, we don't, we have the fewest delays possible. And again, Mike Jones has continued to do a great job, and he continues to be wonderful, and there have been no effects on the front line. And it is just an administrative piece that I thought was useful moving forward as this thing unfolds, because no one knows what the numbers will be like next week. I don't know. But let me finish with Mr. Huckabee, Chief Huckabee. Did you have anything else you wanted to add?
No, sir.
Okay, thank you, Chief. Marisol, did you want to add something?
I was just responding to auditor's office. We have made aware of the reasons why. As far as disability, that was never a direction from our office. Ensuring them that, you know, the PPA will
Thank you.
and if they process the insurance performance, the best way to, you know, they'll track it. But auditor's office is here to assist any entity, as far as, or, you know, how to, how to track.
Just to reiterate, though, it's not a split. That might not be the best description.
So what did happen?
Mr. Villalobos, would you like to expand a little further?
I believe the timeline, time sequence of that, Commissioner Show, was that he made an announcement that was and interpreted as a split. I didn't put a message out to split the EOC. I think the first message that anybody got after that particular call was from one of the EMCs putting out a letter stating that there would be some change in direction for IAPs, which are incident action plans. Unbeknownst to me, and being in another call as a result of that meeting, that's how I found out about it, from an email. But it didn't say split. No one ever said split. As a matter of fact, to this date, there's no articulation on any email or any conversation of splitting our EOC. But I think it was a miscommunication on the singular part, and I'll say it. If you're not familiar with the total operations of the emergency management at the elected level, I think that there was probably some conversations that were misunderstood. And they took that. And I think there was probably some staff members that were on that conversation that ran with that. I did not send a message to anyone that we were splitting. Nothing came from Hays County that we were splitting at any point in time. The only point which I hadn't had the opportunity to be in front of, I wrote a letter afterwards to make sure that everybody understood what we were doing, was just an opportunity for us to organize our inventory, identify it, inventory it, get the numbers. We had large amounts of chemicals that we wanted to log. Those are things that are important for us to log, who we were providing those things to. All those things needed to be in place. And that's what that was about, was a logistics plan to organize all of our materials coming in.
Nothing came from Hays County that we were splitting at any point in time. The only point which I hadn't had the opportunity to be in front of, I wrote a letter afterwards to make sure that everybody understood what we were doing, was just an opportunity for us to organize.
Sorry.
I hadn't seen that look on your face for a while. Like, what's going on?
So just to reiterate, it's a way for us to organize all the materials, receiving them in. I think especially when we get donations, we want to articulate that, get paperwork in, make sure that we're providing it to the appropriate departments to ensure that we're getting those dollar amounts on donations. That's going to be part of our 25% match to the 75% reimbursement. I wanted to make sure that we're maximizing our ability to get our reimbursement for all of the supplies that we're getting, and then we're ensuring that we're logging and tracking all of the supplies that we're disseminating throughout the county, and whether that's going to be to an ESD or a school district or anybody that needs it. I think that's important for us, and then also to really track what our supplies are so that we can replenish them as we continue to go. We need to replenish those supplies. So that was a plan that I wanted to put in place just for us to address.
We have a question, Mr. Commissioner?
Yeah, just two things. I just wanted to clarify, because you stated that there was never anything that went out of the office saying that y'all would be standalone or y'all would do it. So I've got one of the reasons I have a concern is I'm reading a text right here that says, Chiefs, our COVID-19 cases are now set at over 103, and the Hays County EOC is now standalone from the original Hays County City of San Marcos EOC to better service all involved. Most of the requests are for logistics, so we have developed this branch to address those needs. More details will come from the EMC as we move forward.
That's good. Logistics, that points it out. That's good.
No, I'm just saying, I think that you can understand why that would be
yes,
confused as to.
Absolutely.
Yeah.
It says that we're standalone, and I think that was probably where
Confusion.
a lot of that confusion came from. But the fact is that and I appreciate Chief Reyes coming in, Chief Reyes and Mr. Raven coming in to meet me this week.
Sure.
And sit down and have some questions. And I asked the question, when we met, what prompted this? And the response, I said, was there a change? Because initially what was said last week, I believe, if you remember, was that perhaps there was a change in the direction from the state as far as how we should look at this, or maybe that was the case, maybe it wasn't the case. And so I asked Mr. Reyes if we could get some clarification on, was there a change in the way that these operations should be done compared to what's been done in the past? And and the answer was he would check with you and find out because that was his understanding as well. Is that the conversation we had? No, I just want to clarify because at the end of the day, I don't know, I'd like to know, was there a change in direction from the state or from TDM or anybody as to how these things should be done, that prompted this?
Raul Reyes, Emergency Services. So Commissioners, no, I never said that.
Well, please clarify, because I want to make sure that I understand correctly.
Well, first of all, let me preface by saying, as a chief officer for over 20 years, I have the utmost respect for fire and EMS and how they respond to an emergency. That part of it concerned me because I was being told that I was going to change that, and that's not the case. How the county responds, how the chief officers respond to task forces or the incident command, that is their responsibility. Mine is to come in and to offer resources or support. Again, a question was asked as to how we now ask for resources from the county. And we streamlined the operation I say about as close to streamline as you can get. We have now an assistant that assists Alex with the logistics side. And so we've asked the county stakeholders if they have anything else asking for resources, to use that email to Klaus so that he can log and inventory what needs to be done. He then sends that over to Alex. Alex will use procurement or the audit's office to obtain the supplies and materials, and then to make sure that it gets delivered to the Arrington location so that we can, again, inventory it, contact Mike Jones, and have it distributed. It's about as streamlined as it can be done. That's the only thing we did. And so my answer to you is no. I have nothing to do with how the chiefs or the emergency responders respond to an emergency. Again, my position is we're going to have an EOC like we've always had. It's a joint EOC when it involves the county. Most emergencies, they last 2 or 3 days, the max. This one, because it's unusual, is putting a lot of stress on the system because it just continues. And so, no, the chiefs are in charge of responding to emergencies, and how they set up is how they set up. And I'm going there as somebody to offer support and resources. That's all I'm doing. And so the EOC has not changed. The only thing we did was streamline the operation for logistics side. And the only other thing I wanted to do was to remove some of the pressure from Alex by putting an assistant in place to be able to handle the logistics electronically with the stakeholders that need resources. Now, if the chiefs go directly to Mike Jones, that's fine, because Mike Jones is part of the team. And so Mike Jones will turn that information over to our assistant so that he can keep log and keep inventory. The first thing that the assistant did is to go out to all the storage areas and to get an exact inventory of what we had so that we knew exactly where we were at. It streamlined it, it maximizes the ability to get reimbursed. It satisfies the procurement and the auditor. It satisfies state requirements. And so based on the conversations that I had with the director and with the coordinator for emergency management, that's kind of where we went. I have no idea where this split came from. I have no idea that it was going to generate the one simple move of making it logistics just by changing who you ask for resources, that it was going to cause this major anxiety with all the chief officers. That was never my intention. That was never discussed. I don't know where that information came from. I don't know how it was, but it stirred up all the chief officers and the stakeholders. And unfortunately, I think that we have resolved a lot of those issues. But as far as me coming in and telling the chief officers how to handle their emergencies, that's inappropriate. They know what to do, and they have task forces, and they know how to respond. We will set up the EOC to be able to support it and do resources. We have some other plans on how we're going to modify some of the EOC resources in the future, and I'll be bringing that to the Commissioners Court fairly soon, as well as anything else that I'm trying to do or trying to communicate. I'll bring that to you first. My visiting you is not going to be the first time. It's going to be a continual issue with that, so we have good communication between those. And so I intend to go to all of them, all the commissioners, but my plate has been a little full. So it's just, give me a little time, I'll get there. Questions?
Let me lead this meeting, please. I'm sorry, I'm just trying my best to keep order in this process. Do you have any more questions, Commissioner?
No, I'm good. I just wanted to, my request, again, completely agree with you on the operation of the emergency service districts. That wasn't my question. My question was, you and I had talked, you said you were going to ask Alex whether or not there was any different direction from the state, from TDM or anything that
Oh,
had
the
changed.
state,
That's what I
yes,
asked.
the state.
And so my question was, did y'all have the opportunity to have that conversation? And if so, was there any different direction or anything from the state?
No, sir.
Okay, that was my question. It was a very simple question.
Any more questions, Commissioner Shell?
Just that, communication, obviously, these times is difficult. This has been an example of the importance of communication. And, I think, even the email we received regarding this issue would lead me to believe, because the word EOC divided is in there, and the statement of any emergency in the future will revert to the joint EOC operation, that would easily make you believe that it's no longer a joint EOC operation. And so I think that's just a good lesson in
Just so that you'll
communication.
understand, sir, the EOC as it stands right now has county employees that are part of it. It has City of San Marcos people that are part of it. So none of that has changed. Alex is still part of that management side of the EOC. And Eric is still supplying information. We have our financial people involved. And so nothing's really changed.
I think my point is that it was in writing that it is changing or has changed. And if that's not the case, then I wouldn't put in writing that anything has changed.
I think that effort was to describe the logistical processing. Any other questions for Chief?
Well, maybe not one for Chief, though, but also I want to thank Marcel for clearing that, because I was under the impression that it was made after you consulted with purchasing and the auditor, but that wasn't the case. So the other thing, Chief, I think why you saw so much pushback from the chiefs is we've always, as far as I know, and I've talked with longtime chiefs, we've always had a united EOC. We never had a split, or I shouldn't use that word, but a separate EOC. And so I think that's why they had some concerns about it, because it's something that they had, the county's worked really, really hard to have a really good relationship with all our first responders, our fire chiefs, police chiefs, and everything. And it's always been a united front. And so I think they felt like they weren't a part of that discussion. So I think Alex said earlier, and you've said, we just need to do a better job of the communication on the up front part with those frontline people.
Yes, sir.
I think everybody's pretty much said, Judge,
Right.
what needs to be said, communication is key.
So the sequencing, and that's entirely my deal, and I will continue to communicate, and got it. Thank you, Chief, I appreciate it. So what we'll do is we'll take a 5-minute recess.
Don't forget about bringing Mike up.
Yeah, Jones, like we wanted to.
No.
2. That's okay. Will you please open agenda item number 2?
Adopt a proclamation declaring April 25th through May 2nd, 2020 as National Infant Immunization Week in Hayes County.
Second?
We have a motion and a second. Please call the roll.
Commissioner Inglesby?
Yes.
Commissioner Shell?
Yes.
Commissioner Jones?
Yes.
Commissioner Smith?
Yes.
Judge Barcetto?
Yes. Please open 3.
Number 3, adopt a proclamation declaring April 26th through May 3rd, 2020 as Soil and Water Stewardship Week in Hayes County.
So move.
Second.
We have a motion and a second. Please call the roll.
Commissioner Smith? Commissioner Smith?
Yes.
Commissioner Shell?
Yes.
Commissioner Inglesby?
Yes.
Commissioner Jones?
Yes.
Judge Barcetto?
Yes. Please open agenda item number 4.
Number 4, update on census activity in Hayes County by Census Coordinator Jessica Mejia.
And although we don't have Jessica Mejia here, we have our bedrock, Anita, bedrock backup, Anita Collins from our office.
Yes, Anita Collins, office of the Hayes County Judge. So there was a my task timeline that I believe Jessica emailed to everybody, and I think everyone has already seen that. And they were all of the activities that took place through March 14th. So on March 14th, it was the day of the countywide art contest, and it was also the day that our order started to come down to, and the library closed at the last minute. And so the contest was not able to be held, so we had to start shifting our plans and our outreach, and she took that online. And so it just closed, and so she's posted the top 10 online, and I think people are going to vote on their favorites. I'm not sure how she's running that, but that's what's going on right now. And when the art contest was given out or passed out, information on the census was also given to the parents of the children who were doing the art.
Anita,
yes.
the online, the 10 that she posted, where online, how can we look at that?
I don't know. I just saw it last night. She had posted the 10 on, I think it's an event page, actually.
Like
So,
for Hayes County?
is it, okay, it's an event page with.
Since people don't have a camera, will you say who commented and what they
Yeah,
said?
yeah, that was Laureen Chernow, I think.
Can you speak that into the microphone?
Yeah, it's the City of San Marcos Library's page. It was a countywide art contest, but it was the
San Marcos hosted it?
Yeah, the San Marcos
site?
Library hosted it, so.
Thank you.
Okay. So then the winners are to be announced in May, I believe. She's also getting quotes on printing children's census storybooks in English and in Spanish to distribute with the lunches that are being given out right now at the different school districts and schools. It's a really cool little book. It explains why it's important to be counted, and it's something that the parents will probably engage with the children and then also learn and be encouraged to participate in the census. She's also working with the Indigenous Cultures Institute to kick off a writing contest on the census. I'm not sure where that is right now, but that's something that she's working on as well. In your packets that we handed out, we have these little bracelets now for I Count in Hayes County. And It's just the operational adjustments due to COVID-19, so all of the deadlines have been moved up. The self-response rate that was going to end July 31st now ends October 31st. So we have a little more time now to reach all of our county to make sure that they participate in the census. What else? Let's see. Also in there is the Hayes County response rates. This little chart here shows what this response rate has been for every one of the cities in San Marcos. And these are numbers as of last week, so Lorraine will be putting a press release out that will give the new number. But Mountain City is number one at about 74%. They have a 74% response rate, so 74% of the households in Mountain City have responded. The second best is Village of Bear Creek, which is 63.4%, and number 3 is the City of Hayes. And immediately following that is Buda and Kyle. Unfortunately, San Marcos has the lowest response rate, and, but we knew that's where the hard-to-count
The
area
North is beating the South, for crying out loud? Come on.
So we're going to be posting these numbers once a week on social media, just to try to encourage your cities to participate in the census. Let me see, what else? I think that's all I have. We were granted an additional $7,500 to use towards the census outreach from the United Way, and we plan on producing 4 PSAs with that that will be shared with all of the cities in the county to promote, the census.
Any questions, Commissioner Inglesby?
I think I'm good. Thank you.
I just thank you, Anita, for delivering that, and I know it's a hard time to do this work right now, so glad we got some more time on the schedule, it looks like, and hopefully we'll be able to get back to it, because we know it's very important, so thank you, Anita.
That's right, especially with the impact that we're having on our tax base. This will bring more resources to our region. Well said.
I agree. The one thing, just a question for logistics, on the additional grant funds, do we need to accept those?
Yes, we will.
Okay, and then the other question I have is, this is the report that we received back on March 15th.
Right.
And I know that we've asked for a couple of reports, just updates, and at each of those, we've asked that our coordinator reach out to our commissioners to try to get a feel of where it might be possible or helpful in their community.
Right.
We're going on over 2 months now, and I would love to hear from her.
Well, she sent an email out to every one of the commissioners and every one of their assistants.
I've gotten one email so far, and it was
Right.
this update that you referenced here,
Right.
and I would love to hear from her.
Yes, and she sent an email out to each one of the commissioners and their assistants, asking them to call to make an appointment so that she could meet with each and every one of you.
I don't think we got that.
No, we didn't get
Your,
that.
your office is the only one that did respond.
Did we respond?
Yes.
One
your-
that you
your
didn't get, you
assistant did.
responded to. Pretty good.
Well,
But
the-
if you can convey that to her, that'll be
I will.
good.
I
The-
will
the one-
definitely pass it on.
The other thing I would say is that if we are, in looking at where we're at and the dates that are on here, if we're going towards a full-on social media drive, or, I don't want to say internet only, but a more technology-driven way to do this, which it looks like we're going to have to, then I don't know her skill set. She might be the greatest social media person or background in the world. But if we have additional grant money that we're going to get towards this, and we've already dedicated $50,000 of our county money towards this, I would feel very comfortable in trying to go out and find somebody that does this professionally and having, say, look, this is what our need is. Give us a full range of what is possible to do outreach into our community, because I can tell you that just looking at the events and the activities that are on here, I'm more than concerned with the outreach in Precinct 4. And I can say that we're still below 50% in most of my precinct. And I just have a concern there, because, again,
have an executive session item that could help with that in a little bit.
Yeah, we'll talk about them, but thank you very much for your
Sure,
update.
absolutely.
Thank you, and if you will please share, because I know you're the messenger on this one, if you will please share to, especially during this time where our emails are being bombarded exceptionally well, ask her to please send more frequent emails, and if they don't get a response, just send another one and send another one.
Okay.
And then that way, everyone gets the opportunity, because each commissioner deserves to hear from her, absolutely right. And wherever the ball has dropped, it doesn't matter. Let's
Okay.
keep pushing. So thank you so much, Ms. Collins.
Sure.
And,
We have some people from the health department for number 2, I believe. I think they brought their staff.
did you guys bring, for a picture?
No, they have some staff.
Okay, thank you.
Statistics.
Thank you, Ms. Collins. I think we're done with that piece. Thank you very much. So, Eric, did you want to add something on agenda item 2?
Sorry, Judge. I
No,
should
it's
have called
okay,
it earlier.
it's okay.
Good morning again. Despite the fact that y'all only hear me talk about COVID-19 now, I'm glad that we got to actually get this added to the agenda, so I want to thank y'all for letting this get in. Thanks to the advancements of medicine, there are now 14 debilitating and potentially deadly diseases that can be prevented by vaccines if a child is properly immunized before the age of 2. National Infant Immunization Week is a week of observance highlighting the importance of protecting infants from vaccine-preventable diseases and to celebrate the achievements of immunization programs that promote healthy communities throughout the United States. When this annual event began in the early 90s, immunization programs were facing significant challenges. The nation was in the midst of serious measles outbreak, and communities across the United States were seeing decreasing immunization rates amongst all children. Those that don't learn from history are doomed to repeat it.
Right.
Faulty research and social media have led uninformed parents to justify an anti-vaccine movement. As a result, vaccination rates are beginning to dip again, and outbreaks of potentially deadly diseases other than COVID-19 are on the rise throughout our nation, but just not being reported on at the moment. This is not a coincidence. Hopefully, our current situation has opened eyes and helped people realize that when more people are vulnerable to a disease, outbreaks can and will occur rapidly. So the Hays County Health Department wants to use National Infant Immunization Week to encourage parents to vaccinate your children on time and to complete all of the recommended series of doses. If you have questions about the efficacy or safety of a vaccine, please speak with anyone from our department, with a licensed healthcare professional, or conduct your own research, but look at the source of the information you are reading, please. We ask that you do your part to protect your family, yourself, and our community. Thank you.
Thank you, Eric. I appreciate that. I know we all do.
The forms to sign.
Oh, I wasn't gonna do a picture.
Yeah, and Judge,
No, just
just,
gonna give 'em.
I just wanted really to recognize, other than Eric Schneider, who is here, and I really appreciate, Eric, your leadership and everything that you do. We do have Margie Rodriguez, the manager over at our health department, Amelia Flores, our immunization specialist, Josie Gonzalez, M-Track specialist, Sierra De Leon. She's not present. Okay, and then Ian Harris, another epidemiologist, and Sylvia Rodriguez, indigent healthcare screener.
Holding down the fort
Okay,
right now.
and we
Holding down the fort.
really just appreciate all of them, Judge, and everything that they do, and so I wanted to recognize them.
Is there, Laureen, is there an efficient, creative way that we could probably do any kind of? I don't believe so, but if you have an idea. We are, as a court, totally grateful for your effort and your support and your true dedication to something that has fallen on us as a nation, and it has hit you squarely on your department's head. And so we are just eternally grateful, but we can't take a picture with you. We have your proclamation right here. We can't call you up for a picture. And when this is all over, we will revisit this. And so we are very grateful to you, and every commissioner here is equally grateful, I'm sure. And thank you so much.
Eric always sends me his excellent words, and I will do a press release.
Thank you so much. Thank you so much.
Thank
Will
you
you
all.
please open agenda item number 29? Thank you for that.
29, discussion and possible action action to authorize the execution of a grant contract amendment with United Way for Greater Austin in the amount of $7,500 for support of the 2020 census outreach work and amend the budget accordingly.
Second.
A motion and a second. Any questions? Please call the roll.
Commissioner Shell?
Yes.
Commissioner Jones? Yes. Commissioner Smith?
Yes.
Commissioner Inglesby?
Yes.
Judge Baseta?
Yes. And to keep our front line moving, will you please open agenda items 32 through 35?
32, executive session pursuant to section 551.071 and 551.074 of the Texas Government Code, consultation with counsel and deliberation regarding all individual positions in the Hays County Human Resource Department. Possible discussion and/or action may follow in open court. 33, consultation with counsel and deliberation regarding all individual positions in the Hays County Office of Emergency Services. Possible discussion and/or action may follow in open court. 34, consultation with counsel regarding pending and/or contemplated litigation involving Hays County. Possible action may follow in open court. 35, consultation with counsel regarding Hays County Fire Code. Possible action may follow in open court.
And we are going into executive session. We're back from executive session, and I would like to ask our commissioners to call their motion on their agenda item from executive session.
Judge, I have a motion for item number 34.
34, yep.
And if everybody's ready, I don't know if, I'm sure most people have heard of an issue that happened with Kinder Morgan during horizontal directional drilling underneath the Blanco River recently, where they had some issues. The contractor had some issues and ended up polluting some nearby groundwater wells. Because of that, I have some concerns along the route, especially in western Hays County, involving the permits they have to go underneath our county roadways. So we've issued permits for that. I now have a concern that, especially if they're using horizontal directional drilling, that they could hit some karst features, and that's similar to what they did underneath the Blanco. We would not know of that until we had some significant rainfall in some cases, and because of that concern, I would like for the court to consider the following motion. I'll move to rescind any and all permits issued by Hays County to Kinder Morgan related to road cuts across and/or drilling under roadways for the Permian Highway Pipeline until such time that Kinder Morgan has complied with the Railroad Commission notice of violation and provided the plan for moving forward in a manner which will prevent further impact to groundwater and surface water. And number two, Kinder Morgan has provided Hays County with a detailed geology report for each proposed county road crossing, specifically identifying whether the area is underlain by karst. Additionally, I would like to instruct the staff to develop a policy that this court could consider in a future date, that in the event that karst features or geology are present, that Kinder Morgan would do potentially some of these following things: ground penetrating radar studies to identify the voids, caves, or crevices or other features that could pose the risk with a loss of drilling fluid, and then also location of nearby groundwater wells. Maybe staff could consider a radius of the road crossing 1 or 2 miles or something, but I would instruct our staff along in this motion to bring that plan back so the court could approve that, and then Kinder Morgan would know exactly what is going to be asked of them in the future.
Second.
So we have a motion and a second. Are there any other comments?
I just want to compliment Commissioner Shell on looking at this in a very analytical and straightforward way. Given the actions that happened in our neighboring county, I too share his concern and just would hope that we take a strong, hard look at what goes on in ours. And I thank you for it.
And it may be the case that they are in the process of crossing a county road as we speak. I would ask that they be given a notice of this in that instance by our transportation department, and let them know that we're going to ask them to pause that until we come back to court with that policy.
All right, we have a motion and a second. Please call the roll.
Commissioner Shell,
Yes.
Commissioner Inglesby,
Yes.
Commissioner Smith,
Yes.
Commissioner Jones,
Yes.
Judge Barchetta.
Yes, please open 26, 27, 28.
Judge, I have one more motion.
Oh, we have one more motion. Sorry, I'm getting ahead of myself.
Number 35, this is related to the enforcement of our, or the current use of our fire code. I move to provide guidance on the enforcement of the Hays County Fire Code, specifically fire marshal and staff to apply the process utilized prior to the adoption of the Hays County Fire Code on December 17th, 2019. If an applicant filed its first application materials prior to that date and claims to be grandfathered or vested or otherwise exempted under Chapter 245 of the Texas Government Code. Permit application materials that shall be considered include materials related to the following permits: floodplains permits, development services permits, including preliminary permits, driveway permits or OSSF permits. Projects seeking exemption must break ground prior to May 1st, 2021.
We have a motion and a second.
Can I ask one question?
Yes, yes.
So in this case, the individual that meets the timelines that you have explained, they would need to invoke Chapter 245, a similar process to Chapter 245.
Commissioner, I think the endeavor is that they they wouldn't need to use any sort of magic language about 245, but assert grandfathering or being vested in some way, and then that can be analyzed to determine when their application materials were filed.
Judge, one follow-up point that I would make is that we didn't necessarily discuss was, after we finished our conversation, I had a short conversation with the fire marshal, and he requested a drop-dead date. That's what that end date is there. So in other words, if there is one of these applications hanging out there, that it doesn't hang out there forever. And that's what the date of May 1st, 2021 would be. That's included in the last part of that motion.
And just to double check, not to make this a long process, but just a head nod would be okay from our fire marshal. You support this the way it was stated?
What I just did?
We have a motion and a second. No additional comments. Commissioner Inglesby, I see an expression.
Oh, I'm good, Judge, thank you.
I would just take the time to thank Fire Marshal Raven. I know building up to that point of that fire code adoption, a lot of work has gone into that, and he's taken a lot of that on and has spent a lot of time to I think, do the best job that he can and did from the time that he got here. So I know it's been very challenging, and anytime something new comes out, makes it even harder to do your job, but I think he's done a good job.
I would echo your comments. And thank you for your ability and willingness to work with our citizens out there.
And as a final comment, thank you for your dedication to the craft of being a fire marshal and your pursuit of public safety. That's very wonderful. Please call the roll.
Commissioner Smith?
Yes.
Commissioner Inglesby?
Can you repeat?
Inglesby.
Yes.
Commissioner Jones?
Yes.
Commissioner Shell?
Yes.
Judge Barcetta?
Yes. Please open 26, 27, 28.
26, discussion and possible action to authorize an amendment to the laboratory testing contract between Hayes County Local Health Department and Clinical Pathologies Laboratory effective March 13, 2020 to include the testing of COVID-19. 27, discussion and possible action to execute the contract with Premier ER and Urgent Care related to COVID-19 testing effective March 13, 2020. 28, discussion and possible action to execute a contract with Black Oak Partners Community Clinic related to COVID-19 testing.
Okay, Ms. Crumley, batter up. You want to take one at a time and tell us the backstory?
Yes.
If necessary.
Thank you guys very much. I appreciate it. That's the right route.
So item 26 on the clinical pathologies amendment. We do not have, when this was executed, obviously COVID-19 was not an issue, and we did not have a item on our contract for COVID testing. So this is adding specifically the COVID-19 testing to our agreement with CPL at the rate of $70 per test and not to exceed the $91,000. That number is based on the grant that we approved last week in court.
Now, before you go to the next one, I wanted to ask you a quick question on that one. I have a neighboring county, because it's no secret, I've been pushing for securing tests. I have a neighboring county that has access to a PCR molecular test, FDA credentialed, for a lower amount, much lower amount than this. So how could we address that potential price savings? Do we, not to exceed, or how, Mr. Kennedy, maybe that's a question for you. How do we address that? It seems as though we have access to a lower dollar, properly credentialed test besides the $70 one. If you guys can guide me on that. I'm sorry to do that to you. It's just the front page of item 26, and I have the actual, I don't know if you have this in front of you, Mr. Kennedy.
What are they paying for their test?
Well, I just feel bad calling it out loud, but it's a lot less, but so I understand in helping people and keeping labs going, but I wanted to see if there was some kind of possibility for us, if a better price is acquired, that we address it. That's all, just to get more tests. That was my only effort. Mr. Kennedy, I know this was the last minute. Would you like me to pass you this?
Sure.
Thank you.
Where'd you get your mask?
Judge, I guess my question is, if we're just adding capacity here, but we're not mandated to have to use it, are we?
That's what I want to clarify.
Yeah. I guess, so I'm all for adding all the capacity with these tests.
I just want to be locked into a price that may not be.
Yeah.
That's all.
That includes the test kit.
The lab too,
The
right?
process and the interpretation of the test.
So that includes the lab fee?
Yes.
Good to know. Thank
It's
you.
not just the test kit. And then they're
Perfect.
reporting it back to our epidemiologist.
Perfect.
But this would not keep us from finding someone else that could offer the same services.
No.
It's not an
essentially at a-
exclusive.
That's
Right, right on.
Isn't,
Okay.
from a procurement standpoint, I would note that this is an amendment to an existing contract, which is one of the ways to get there. So, but certainly worth looking into pricing elsewhere if there's something available.
Thank you, Mr. Kennedy.
And Tammy, can you talk, how many CPL sites do we have in Hayes County, do you know?
I believe we have 2, but they're doing their testing in Austin. They pick up the test and they run the lab
Okay.
test in Austin.
And I hear the turnaround time is 24 to 48 hours. I'm not complaining about them at all. I hear they're doing a great job.
And we get it sooner sometimes, don't we? Or
It
do-
depends on the time of day that they do a pickup in the morning and then in the middle of the afternoon. So it's like 10 and 2, so it depends on when the test gets picked up.
Any other questions on that agenda item? Because I know we opened all 3 at the same time. Did you want to add anything to that agenda item, 26? We'll
No,
discuss 27.
27 is, sorry, let me get caught up, is with Premier ER and Urgent Care. They have been doing our testing since the onset of this, and so that would go back to the declaration date of March 13th. You'll see in Exhibit B, the scope includes the invoices that we've been billed to date. They have been gracious enough to give us a 50% discount on those invoices that were billed up through last Friday, the 17th. We will pay those invoices from the funding that was approved a couple of weeks ago, and then going forward, there will be no charge for their services of administering those tests. They are not going to have the staff on site that they had previously for that. So they'll be able to operate with just what they have at their regular ER and urgent care facility.
I'll make a motion to approve.
Oh, we've already opened all 3 and approved.
Okay. I didn't know if we were motioning on separate.
No, I opened all 3 because they were together, so we can have a complete conversation. And then on Exhibit A, you have we will be testing: first responders, healthcare workers, individuals who have contact with the vulnerable population. This isn't one of those exclusives, only this, and I just want to make sure that, since the way it's
Those,
written.
no, we will cover through Hayes County. If you'll see on, under Hayes County, the copy that you have under number 1, those will only be by referral from our Hayes County Medical Authority or from the Health Department. So if anyone else comes to Premier, that's on their, from the public. But under this agreement, they'll provide those services through a referral from our medical authority or from the Health Department at no charge, other than us paying the lab fee.
And I know we're working through this because this is all new to all of us. Okay, commissioners, any other questions, starting with you on this side? No?
I guess both the contracts, I went through both of them, but I see they're the exact same, aren't they? Pretty close to.
The Live Oak one is different in that they'll be providing the services for the uninsured, underinsured, and the indigent population.
I meant the actual services provided, though.
I'm sorry, yes, sir.
Yeah, okay.
So this, on number 27, and what the judge mentioned, that these are the referrals that come from Hayes County.
Correct.
If Eric makes a decision or Dr. Anderson makes a decision that someone needs to be tested, then they would be sent under this agreement. If they were, the next item at the clinic would be for our indigent underinsured, uninsured populations, that is how they would be tested then.
Correct. On the Live Oak item, they are also, the first responders and healthcare workers are also listed in the event we need those services there as well. So, back up.
So that's what we're trying to do, that's why we open them together, is trying to understand and share with the viewing public the general roadmap of testing. So thanks for clarifying that. Do you want to speak more on 28?
It mirrors that with the exception that that is the location for the underinsured, uninsured, and indigent population.
And then it's for the viewing audience, because I have a lot of this background already in my head, but can you just tell the viewing audience, I know it sounds weird, but tell them again what you've said about 28.
So they would go to the Live Oak location. Is that what you're talking about okay. If they had a referral from our Hays County Health Authority, which is Dr. Charles Anderson, as our health authority, not from his private practice, or from one of our epidemiologists at the health department, Eric Schneider or Ian Harris, and be able to get testing at one of these locations, either a first responder, medical personnel, or someone working in the vulnerable population or exposed. Kind of the tracing that we discussed on, once Eric talks to the individual and trace testing based on who they've had exposure to, what the situation was, that falls into that category. And also the uninsured, underinsured, and indigent population.
And so just to double down on communication, when, let's say I am uninsured, underinsured, unemployed, and I have a strong suspicion that working in my drive-through business that is still vulnerable and open and essential, I've now developed symptoms. Eric says, yes, you should get tested. What would I pay for that going through our health department, through item number 28?
Through Live Oak.
Yes.
There should be no cost to that.
Thank you. I want to clarify
No
that.
cost to the individual.
I want to clarify that out loud, where people hear it and understand it. I want
There will be some questions that need to be answered.
course, of
And we
course.
haven't gotten that far yet with Live Oak. There'll be some triage. In addition to the medical questions, we'll need to.
Sure, everything's going to be qualifying, but I just want to reiterate to the people watching, because as Commissioner Jones said, we're probably the most highest-rated show on TV right now.
I want to be clear that it's not just a drive up right now and you're going to get tested. You'll
Exactly.
need to call and.
Exactly. Call ahead, and if deemed necessary, if a test is right for you, then you will go to this Live Oak at no charge based on the criteria. The credentialed individuals will triage you through.
And once we have, Live Oak needs to have time to get that live and up and running. So we'll be able to announce, when that's available.
And just for understanding additional information, capacity and time to be ready. Do you have a ballpark conversation point around that?
I do not at the moment.
That's
I
okay.
haven't had to.
I'm not trying to grill you, I'm trying to
Yes.
share information. Sorry if
I
it comes
should be
across
able
that
to
way.
get with Kathleen at Live Oak
And Kathleen's phenomenal. She's a huge asset to us, and so I know they're doing a great job.
they already have their one clinic up and running, their walk-in, so
Good.
they know.
And Tammy, I've got a question. So if a person that is uninsured, underinsured, or is an indigent, and if they have these symptoms that have worsened, say at midnight when Live Oak is closed, then Premier ER will be able to take them? Or
We can't send them here, yes.
Okay, but would they still, at that time, would they have somebody to talk to prior to going, or do they just go to Premier ER?
So an after-hours Live Oak is what you're asking, right?
Right.
An after-hours Live Oak potential, could Premier ER, I know we're reaching here, but that's a great question. Could Premier ER work as the after-hours Live Oak site if necessary?
We can build that in, yes.
That's a great question.
We can work that in with Premier.
And as a double down of information, and I'm sorry if I put you on the spot, but can you say the phone number that people should call that feel they have the symptoms? I'm seeing some nods, so we'll leave it alone. The point is just to share information, but we'll go through our public information office to tell them when this Live Oak piece will be ready and the process.
Yes, I'm not sure what number Live Oak is going to want to publicize
Okay.
yet, so we'll
Good.
get that information
Good.
out.
I'm very happy and grateful for the work you guys are doing. You guys are satisfying a huge emotional need. If you don't get an onslaught of people, that's okay. You're satisfying an emotional need that we all feel very, very pressured and pressed on to satisfy. So thank you for doing what you're doing.
And Live Oak and Premier will also be doing their own testing outside of what the county has in these two agreements.
In the press
There'll be
release
two
that we
additional-
create, I'm sorry, I spoke over you. In the press release that we will create, telling folks about these agenda items, if and once approved, I'd like for you to consider including some numbers of capacity or anything like that, so that people have an understanding of a roadmap, just to be extra clear as our PIO as well. Well,
These-
thank you.
These items are being funded under our grant that was approved, so those were for the, if we're using the CPL price, then that was a total of 1,300 tests that it was covering. We've already used 137 of them.
Beautiful. Thank you. Thank you. Any other questions?
Just one quick comment, and we've said this before, but I think the health department, and Margie is still here, and Eric Schneider's here, Ian Harris is our other epidemiologist in their team, and of course Tammy, and that, I noticed where a county nearby to us was considering recently of hiring an epidemiologist. I can't imagine a county of the size of us or one similar to us going through this without professional team. And we're extremely fortunate that department for years, long before I got here, was built in a way that had these resources through partnerships with the state and grants that has really served us well. And so I just want to point that out, that there's many around us that wish they had the type of staff that we have in Hays County, and that's because of a long-standing policy of this county, and Commissioner Inglesby knows it better than any, but that clinic and that location on Broadway has been something that has never been mandatory for the county to do, but it's been something that the county has supported, and we've had some amazing individuals that have worked throughout that clinic over the years. So I just want to make sure that people understand that perspective. So thank you all.
Thank you.
Wonderfully done.
Yeah, that's
So we have open 26, 27, and 28, and now we've had some good conversation about clarification of use. Will you please call the roll?
Commissioner Jones?
Yes.
Commissioner Shell?
Yes.
Commissioner Smith?
I'm going to say yes. I don't know if it was me or not.
Commissioner Inglesby?
Yes.
Judge Baseta?
Yes. Now, are there any other frontline agenda items where we can keep people moving?
Are y'all good?
You guys are all in good shape, right? Thank you very much.
Y'all so much.
Will you please open agenda items 5 through 12?
Number 5, approved payment of county invoices. Number 6, approved payment of United Healthcare claim. Number 7, approved Commissioners Court minutes of April 14, 2020. 8, authorized payment to ProPac Inc. for $503.48 for PPE eye protective wear related to COVID-19 response, in which no purchase order was issued as required per county purchasing policy. Number 9, ratify the donation of 53 face guards and 152 face masks from Fanside Inc., valued at $3,072.95 for the Sheriff's Office, and amend budget accordingly. Number 10, ratify the submission of a grant application to the Department of State Health Services for the FY 2020 COVID-19 Crisis COAG grant, amending the original application to add an additional $154,794. Number 11, authorize on-site sewage facility permit for a single-family residence and 3 short-term rental cabins located at 501 Jennifer Lane, Driftwood, Texas, 78619. Number 12, authorize on-site sewage facility permit for 3 long-term rental single-family residents located at 120 Lane, Dripping Springs, Texas, 78620.
So moved.
Second.
We have a motion and a second. Commissioners, any comments?
Judge, I just would like to thank Sad Socks for their donations. These are the masks they made, and they're located in Buda, and we appreciate their donation to our sheriff's office, our officers.
Wonderful. Please call the roll.
Commissioner Inglesby,
Yes.
Commissioner Smith,
Yes.
Commissioner Shell,
Yes.
Commissioner Jones,
Yes.
Judge Baseta.
Yes, please open 13 through 17.
13, approve utility permit. 14, authorize the sheriff's office to accept a donation of $1,000 from the San Marcos Lions Club to utilize the supplies and materials for the drone program and amend the budget accordingly. 15, approve specifications for RFP 2020 P10 bank depository and authorize purchasing, solicit for proposals and advertise. 16, approve extension of RFP 2015-06 bank depository with Sage Capital Bank NA for a period not to exceed 103 days to 2020. 17, authorize the submission of an extension request to the General Land Office for the Cotton Gin Road Project contract 18-501-00-B226 Community Development Grant to Recovery Program Infrastructure Project non-restricted development flood allocation.
Thank God we can read along.
Second.
We have a motion and a second. Are there any other comments?
Thanks to the Lions Club.
Yes. Yes, thank you, Lions Club.
Absolutely. Please call the roll.
Commissioner Shell,
Yes.
Commissioner Smith,
Yes.
Commissioner Jones,
Yes?
Commissioner Jones,
Yes.
Commissioner Inglesby,
Yes.
Judge Baseta.
Yes, please open 18 through 23.
18, approve the updates to the Texas Property SS Clean Energy Authority project documents approved by Hays County Commissioners Court on or about January 17, 2017. 19, authorize the execution of $3,335 service proposal with Fire Troll Protection Systems for fire alarm control panel repairs at the Juvenile Detention Center. 20, amend the Constable Precinct 2 operating budget for $3,915 additional costs associated with the motorcycle unit approved in the FY20 budget process. 21, authorize the county judge to execute a proposal for Conference Technologies, Inc. related to the back-end processing and display wall system for new public safety buildings and amend the budget accordingly. 22, authorize the purchase of a replacement launch convection oven valued $3,906.47 for the Juvenile Detention Center and amend the budget accordingly. 23, authorize the Transportation Department to purchase a new laptop computer for engineering technician at 1021001 and amend the budget accordingly.
So moved.
Second.
We have a motion and a second. Are there any comments? Please call the roll.
Commissioner Smith,
Yes.
Commissioner Jones,
Yes.
Commissioner Inglesby,
Yes.
Commissioner Shell,
Yes.
Judge Baseta.
Yes, please open 24.
24, discussion and possible action to request that the Texas Department of Transportation initiate the process to remove a portion of FM 2770 Robert S. Light and 0.10 mile north of the intersection of Robert S. Light in the state highway system and convey to Hays County for future ownership of the right-of-way and maintenance.
Hey, Judge, this is a,
Oh, let's get a motion first.
let's go, so moved.
Second.
We got a motion and a second. Yes, sir.
This is a part of our partnership project with TxDOT for them to do the construction of the extension of Robert Light from 35 all the way to 1626. That'll become state highway roads, and then portions of 2770 will become county roads, was part of the deal. So,
We have a motion and a second with comments. Are there any other comments? Please call the roll.
Commissioner Inglesby,
Yes.
Commissioner Shell,
Yes.
Commissioner Jones, Commissioner Jones?
Yes.
Commissioner Smith?
Yes.
Judge Becerra?
Yes. Please open 25.
25, discussion and possible action to award contract to IFB 2020-B05 US 290 at Switchwain Road, temporary signal to Austin Traffic Signal Construction Company, Inc.
So moved.
Second.
We have a motion and a second. Commissioner?
Thank you, Judge. This is actually the intersection that we went to bid on. I guess it's been 3 months ago now. The bids, totals are in the back of the packet, and I would just point out of the 3 bids, the bid that we're going with is actually 33% less than the highest bid. It's the lowest bid by far. And I know that the residents there are very excited about this. This is the first step in the process of a project that, or the first step in the construction of a project that was part of the 2016 road bond.
Beautiful. Any other comments? Please call the roll.
Commissioner Smith?
Yes.
Commissioner Inglesby?
Yes.
Commissioner Jones?
Yes.
Commissioner Shell?
Yes.
Judge Becerra?
Yes. Please open number 30.
30, discussion and possible action, authorize the judge to execute a software license conversion request form, net, and to add 32 licenses to a subscription license model.
So moved.
Second.
We have a motion and a second. Commissioner Shell?
Thank you, Judge, and we have Mr. McGill here that can expand on this. This is a net motion. It's part of this, the CAD conversion that we're going through right now into the New World CAD system. And these licenses are needed to bring all of the other entities all underneath us. They will still be responsible for them individually, but it will be within our program. And Mr. McGill can explain more.
Yeah, that's correct. The reason we're doing the license conversion is because we want each agency to be able to manage the security end of their mobile devices, of being able to add units and take units away without having to go through the county for every time they want to add a unit. This just adds the feature set so we can create some subservers for each agency so they're in more control of their security for their agency. We're also adding an additional 33 license for fire EMS and Buda PD because they have a shortage of license with the amount of devices that they have on the network.
Okay, any questions? Please call the roll.
Commissioner Inglesby?
Yes.
Commissioner Smith?
Yes.
Commissioner Jones?
Yes.
Commissioner
Yes.
Judge Becerra?
Yes. Please open 31.
31, discussion and possible action to authorize the county judge to execute an interlocal agreement between Hays County and Sunfield Municipal Utility District Number 4, a political division of the state of Texas related to road construction and maintenance within the Sunfield development.
So moved.
Second.
We have a motion and a second. Commissioner?
Judge, this is an agreement between us and Sunfield. Sunfield Mud, which is, they have the ability to do this, has decided to take over the inspection of their roads within their mud. These roads, we made it clear to them, with this action, they would never become county roads. In fact, by the time the mud is done, Buda should annex them, so they would never be county roads at any point. Jerry and I have met with them. Caitlin's met with them also, and we've worked out, a plan of which roads within that subdivision are still county maintained and which weren't. We're asking them to put up a different type of street sign for the roads that are theirs, so they'll be easily distinguished. And I think we have approval, staff approval from Caitlin and Jerry.
Beautiful. And MUD, for the viewing audience, is Municipal Utility District.
I have
Thank you. Yes, sir.
a couple of things to add, if you would, Court. One, I left the red line in backup on the court's agenda so that you could see some of the changes that we made while negotiating this. There are a couple of changes that I'll verbally note for you. I sent to you court members this morning. I didn't want to hand out and keep our physical contact down as much as we could. There are actually quite a few more maps that are in an exhibit to the agreement. We wanted to be sure we capture every road that is in this greater development. So the maps that I sent this morning will be in backup. And the other little wrinkle that needed to be ironed out is that there are a couple of roads or a couple of instances where it makes more sense for the MUD to maintain, even if perhaps the county has already inspected that portion of the roadway. You'll see in the backup you do have, for instance, on page 207, there's the map you have. It's colorful, it's red, yellow, and lots of other colors. There are 3 areas that are highlighted, areas 1, 2, and 3. Those are either half-built roads or roads that are in a section that is going to be MUD maintained, and so it would make more sense for the MUD to take those. And we may have a couple of other examples of half-built roads that are out there. We're going to make sure we catch them all before we have this fully executed and ensure that the MUD is delineating that properly. Those are the only changes, though.
So Mark, when I was looking at the map, 1, 2, and 3 that you just outlined,
Yes.
it looks like the color is gray, so I thought they were going to be county. Is
Well,
it actually?
we've confirmed since we put backup in place here that
that's
these will be MUD maintained.
Okay.
You'll notice with numbers 2 and 3, those are actually half-built roadways. There's only one side of it built.
Right.
Now, that's just the nature of how this area is being developed, but those will become MUD maintained. They agree with that. Number 1, you'll note that the rest of that entire section is going to be MUD maintained, so it makes sense for them to go ahead and take that over.
Yeah, that's
So-
what I thought too. Okay.
And then also, I have met with the city of Buda, so they know the transition that's going on, that they'll know that those aren't our county-inspected roads. If they ever do take those roads over,
Do we know when they may annex?
it'd be 20 years probably.
Jeez.
Once, it'd be till it wouldn't be till the bonds are completely paid off.
Both the city and the county were interested in seeing the third-party inspection reports. That's one of the things that you'll note that we've added to the red line, is that we would like to see certain things, and if we ask for the third-party inspector to provide more documentation, then we can do that, so.
Any other comments? Please call the roll.
Commissioner Smith?
Yes.
Commissioner Shell?
Yes.
Commissioner Jones?
Yes.
Commissioner Inglesby?
Yes.
Judge Becerra?
Yes. Please open number 37.
For the last item, we got it perfect.
We nailed it.
37, discussion related to Hayes County inmate population to include current population counts and costs.
We're moving in a really good direction for whatever reason. I just want to thank everyone taking part in this that's tied to anything criminal justice in our county, from attorneys to judges to sheriff's office to DA's office. Everyone involved is bringing these numbers down in a way that is very beneficial to us as a community. And I want to read the report that the sheriff sends my office every week, which is jail capacity. Hayes County's current maximum jail capacity is 362 inmates. Jail Standards recommends holding approximately 10% of capacity open. That lowers our capacity to 311. The jail's daily average was 388 and peak was 392 on April 18th for the week of April 12th through April 18th, 2020. The estimated cost of outsourcing inmates this week is $56,432. The average number of outsourced males is 139, and females, second week in a row, 0. That's a real big deal. This week's inmates were housed in the following counties: Burnett, Caldwell, Fort Bend, Guadalupe, Travis, and Walker. Are there any other agenda items, standing agenda items, that you guys would like opened?
No, Judge, I just want to comment on while you have the sheriff's office open, I want to thank Sheriff Cutler and our sheriff's deputies for covering for the city of San Marcos on Saturday night, and then I think they covered yesterday for the calls while they did the procession too. So appreciate our county's law enforcement stepping up to help San Marcos in this time.
That's right. I'd like to expand. I had my radio on, and I actually heard SMPD hand it, tie over to the sheriff's office, and then sheriff's office one step further also benefited getting help from Kyle.
Yep.
City of Kyle. So that just shows the strong need for our co-located dispatch. It shows the unity. It shows that we have a good body of front line, ready, willing, and able to help. And I think that this co-located dispatch that's being built is going to be a great asset once we have everybody consolidated and we can see where everyone is at, and we can more seamlessly make those kinds of transitions. So good job to everyone that's worked on that in the past. Thank you. I'll entertain a motion to adjourn.
So moved.